I'm Deborah Bates, and it's my absolute pleasure to welcome you all to this webinar, Increasing Cervical Screening for People with Disability. We're going to start now. We know we've got a mixed audience of people with disability. We've got supporters, we've got people who work in research and clinicians, and people from the government as well. So welcome to everyone. And I'd also just like to thank the Department of Health, the National Cervical Screening Programme, for supporting this webinar. So let's move on to the next slide. Tammy, I'm going to hand over to you for the Welcome to Country.
Thank you, Deborah. Acknowledgement of country. I'd like to acknowledge the lands that we're all meeting on today. I'd like to pay respects and honour elders past and present and Aboriginal people who have joined us today from other lands across the country. Aboriginal people have suffered through colonisation, and it is a testament to the strength and kinship that we still have community today. Aboriginal people are continuing custodians and traditional owners of this land, from the red dirt country of the centre to the green lush river country and saltwater country around us, surrounding us. Thank you.
Thank you so much, Tammy, and that's lovely artwork by John Gilroy. So we'll all be hearing a lot more from Tammy as one of our screening advocates very soon. So just to give a rundown on the presenters, I've already mentioned, I'm Deborah Bateson. I'm a doctor, previously medical director at Family Planning, New South Wales. In the past 3 years, I'm a professor of practice at the University of Sydney. And I'm going to hand over to Marianne O'Donovan to introduce herself.
Thanks, Deb, and welcome everybody. Delighted you could join today. I'm Marianne O'Donovan. I'm the CEO of the Centre for Disability Studies and Associate Professor of Disability Studies here at the University of Sydney. And this has really been a team effort. So I will hand over to Emily and the team who are behind the scenes who've made this happen today. Over to you, Emily.
Good afternoon, everyone. I'm Emily, and we've been putting together this webinar, and we're really happy to see you all today. And I'm here with Edie, who has been doing lots of behind the scenes work on this project.
Great. And our screening advocates will be presenting today. So I'll hand back to you, Deb, and you can.
Yes, well, we might just get Tammy and Sue just to come on screen for a minute and just tell us who you are. And obviously, you're going to be the stars of the show later on.
After you, Tammy.
Thank you, Sue. So my name's Tammy Milne. I'm a woman with physical disabilities. I'm a wheelchair user and have some voice difference. So I have a tracheostomy as well, which means that sometimes I talk, sometimes I sign, just depending on how my voice is on the day and how loud a room is, because the louder the room, I just can't project. So I have to. And I'm really glad to be a part of this project because from my own personal experience, I didn't have a screening for 13 years because I was so traumatized by previous experience trying to get on the table and the physicality of it. Yeah. And I recently went and had the new self-screening, cervical screening, and it was just a game changer.
Tammy, you are a fabulous advocate.
Thank you so much.
I'm just going to move us along now because we're going to hear all about your story, but thank you so much for sharing. Sue, over to you. Yeah.
Oh, good afternoon, everybody. I'm Sue Lewis from the Adelaide Hills, beautiful Ghana country, and I'm delighted to be here today and providing my input to this wonderful webinar. Thank you, Deb.
Well, we're delighted to have you both here, so thank you. Thank you. So just to set the scene really with some learning outcomes for the webinar, we just all need to know, of course, that cervical cancer is an awful disease, but it is one of the easiest cancers to prevent. So that's what this webinar is all about. And it's really important that we all understand the different ways to do the cervical screening test. There is a choice now, including what Tammy mentioned around the self-swab. It really has changed the way and overcome barriers, as we'll see. So change the way we do cervical screening. It's important that everyone knows their rights about cervical screening. And we're going to look at what makes it difficult and what makes it easier for people with disability to have a cervical screening test. We're going to understand the National Cancer Screening Register and the important role that it plays, and think about how supporters can help people with disability have a cervical screening test. And then we're going to hear from fabulous cervical screening advocates with lived experience, Tammy and Sue. So lots of things to look forward to. A bit of housekeeping. There is a dedicated Q&A session at the end. So please do put your questions. You can ask any questions of any of the presenters, and Marianne as well. So put your questions in the Q&A box. That would be fantastic. We will have a short 5-minute break in the middle. There's live captioning under the show captions in the meeting controls at the bottom of your screen. And then you select your preferred language. So thank you for that. And there's also Auslan. So click the interpretation icon. It's like that world sign on the toolbar, or click on more if the icon isn't visible, and then select Auslan from the language list. So thanks to all our supporters. So here's our agenda for this hour. So we're going to start off with just some background on cervical screening, and then there'll be a quick break around about 12:55, just for 5 minutes. You get a cup of tea, and then we'll hear from the screening advocates, and then have our Q&A session. So do put those questions in the chat. So let's start now just with some background to set the scene for us all about cervical screening. Cervical cancer is one of the easiest cancers to prevent. And Australia is predicted to eliminate cervical cancer by 2035. In fact, we're predicted to be the first country to eliminate cervical cancer, and that's because of our HPV vaccine program. So we vaccinate girls. We started with girls in 2007, and then we added boys in 2013. So we're vaccinating 11 and 12-year-old, 12, sometimes 13-year-old boys and girls now. We changed to a single dose of vaccination just in 2023. So it's also, of course, because of our screening program. There was a major change at the end of 2017 with the change from pap smears every 2 years to HPV tests. HPV stands for the human papillomavirus, and we'll hear more about it. We've got a national strategy for the elimination of cervical cancer, and the key thing is that we must make sure this is done equitably and we don't leave anyone behind, including people with disability. So let's have a look at that human papillomavirus I talked about, HPV for short. We know this causes almost all cases of cervical cancer. The important thing to know is that HPV is very common. It's a common infection. In fact, over 80% of people have HPV at some point in their lives, and the majority of people, the body's immune system makes it disappear, so the body clears it itself. But in some cases, the HPV infection does actually persist, we call, or stay on in the body. And it can, if it stays on, sometimes it can cause changes to the cervix. And in time, and this usually takes around 10 or 15 years, these changes could lead to cancer of the cervix. Now, where's the cervix? People don't always know where their cervix is. It's inside the body, and it's at the top of the vagina. It forms a canal between the vagina and the uterus. And in fact, these are talking cervixes here in our animated Screen Me campaign. Then you'll see a few more of them later. So the cervix does look, someone said it looks a bit like a blueberry, but it has got a hole in the middle, a bit like a donut. So important to know where the cervix is. So let's come to how we can prevent cervical cancer. So as I mentioned, it's through the HPV vaccination program, girls and boys aged 12 to 13 years. The good thing to know is that if someone misses out at school, maybe they're not at school on that day, then in fact that you can get a catch-up vaccination. You can go to your GP anytime up to the age of 26. So once you turn 26, it's not free after that. So this is free, and that's really important, this catch-up. So do think about that. And then, of course, it's through the cervical screening program. So, and cervical screening is actually for women and all people with a cervix aged 25 to 74 years of age. And cervical screening with an HPV test occurs every 5 years. We've actually got a much more accurate test than the old Pap test, and it has to be done, it can be done less often. So very many pluses with that, of course. So now, as I mentioned, the cervical screening test can actually be done in 2 different ways. It can be done by a doctor or a nurse, where they take a sample from the cervix using something called a speculum. It's that instrumental tool that you see there that is allowing Dr. Yvonne from Family Planning New South Wales. She uses that tool to be able to look at the cervix, and then she can take a sample of cells with that soft brush there and put those into the tube. So she's collecting those cells. But we've also got a new way of doing screening now. So since 2022, the middle of 2022, everyone who's eligible for screening can also choose to take the sample themselves. We call it self-collection, taking a sample yourself from the vagina, just the lower part of the vagina, using what we call a self-swab. And that's what it looks like there. Now, the key thing is that people can sometimes feel, particularly some people with disability may not be able to do it themselves because of their disability, or they may feel unconfident about inserting the swab into the vagina. So you can actually also ask a doctor or nurse to help you take the sample from the vagina. But it's just a word to say that this should always be a healthcare professional. It shouldn't be a paid support person, for instance, because we know that, this is a medical procedure. It's an invasive procedure, and we want people to understand what's happening. This is what the swab looks like. I have to find it on my on my camera there, and it's inserted into the vagina. It's just rotated just for 10 to 30 seconds, about two or three times, or 1 to 3 times. Very easy to take it. It's just really important to know there are these 2 choices now, including taking it yourself. People ask common questions about the cervical screening test. Is self-collection as accurate as when the doctor or nurse does the test with a speculum? And the answer to that is yes. Both ways are very accurate. In fact, they've got equal accuracy. So that's important to understand. People sometimes think, does having HPV mean that I have cancer? And they may feel nervous about having the tests because they have that misunderstanding that HPV means cancer, and we say no to that. It doesn't. Having HPV is very common. As I mentioned, most people will clear the virus, but sometimes it stays on, and we pick that up in the cervical screening test. So if you do have HPV, don't worry about it. The doctor or nurse will talk to you, will explain what you have to do next to help prevent cervical cancer from happening. So what about follow-up after you had a test? So the doctor or nurse who takes the test or organises the self-collection will let you know how you're going to get your results. It's important to understand, are you going to get a phone call? Are you going to come back into the clinic later? So there's different ways you can get those results, and it usually takes about 2, sometimes 3 weeks. And the results, you'll have one of 3 different types of results. Sometimes we look at them like a traffic light. So the majority of people who have an HPV test, a cervical screening test, will have no HPV detected. They haven't got HPV, and we know it's very safe for these people to say, that's fine, go away, and you can come back again in 5 years. This is very safe. A small proportion of people, a small number of people, if we go to the other side, they'll have what we call HPV type 16 or 18. These are the types of HPV which are more likely, they're the types that are most likely to go on to form cervical cancer. And we take these types seriously. If these types are detected on your cervical screening test, the doctor or nurse will talk to you, and the doctor will refer you to have additional tests with a specialist doctor, because what we need to make sure is we do a test called a colposcopy. A colposcopy is having a very close look. It's like a magnifying glass at the cervix to see if there's any changes that can be seen, and we'll take a little sample, sometimes a tissue sample, a biopsy, because we want to see if you've got those cell changes. We can treat them to prevent cervical cancer. And there'll be some people in the middle there where they've got other HPV types detected. So not those ones 16 and 18, other types which are less likely to go on to develop into cervical cancer. They're more likely to clear by themselves. So we know it's safe for these people to come back in a year and have another test to see whether the HPV is still there or not. So I mentioned before, it's so important that everyone knows their rights about cervical screening. Everyone with a cervix, age 25 to 74, need to know. We all need to know that having a cervical, everyone has the right to have a cervical screening test or not. So all of these are choices. You have the right to see a female or a male doctor or nurse. Again, that's your choice. You've got the right to ask for an interpreter. And again, as a person with disability, you can decide whether you want to take your support person with you to the consultation for all of the time or just some of the time. They may come in to start with, but you prefer them not to be there the whole time. You can also, of course, choose to go on your own. And importantly, particularly if you're having one of the tests where it means using that tool, the speculum, some of you will know about it. And it can sometimes cause a little bit of discomfort. And certainly if you're experiencing any pain or discomfort and you just simply want to stop the procedure, then it is your right to say stop at any time during the test. So let's have a look now at what makes screening difficult for people with disability. There's lots of different layers that can cause many different types of barriers. They can be at the society level, stigma and discrimination. We know that people with disability have less access to preventive health care. People may have financial difficulties. People with disability, we know sometimes, miss out on sex education, learning about the body, the cervix at school, because it's thought sometimes not to be important, which of course is nonsense. Everyone has the right and needs to receive sex education. And we do know, unfortunately, that there are very high rates of institutionalized sexual abuse for people with disability. And this can be a barrier to cervical screening. And that's why we want people to know about the self-swab, because that's a much simpler test and you can do it yourself. There can be individual barriers. We hear from people with disability about fears and anxiety. They say that having a cervical screening test was scary or frightening, and they may have had past bad screening experiences. So again, we want to let people know there's a new way of doing the cervical screening test with the self-swab. Healthcare providers, we know that, always healthcare providers want to do the best by you and provide the best services, but they do sometimes, I know I'm a doctor myself, lack the skills and confidence to provide that inclusive care. And we need to make sure we're doing some training for healthcare providers to ensure that they do have that confidence. And again, don't feel worried as well, that if you feel that it's something that would be useful for the doctor or nurse, that you can tell them or no, do feel that you can speak up. There can be misassumptions about sexual activity. Perhaps sometimes the doctor or nurse may think that a person with disability is not having consensual sexual activity, which can be wrong, of course. And of course, sometimes in a busy consultation, there can be competing health demands, and screening can go to the bottom. So very important that we remember it. And the clinics can simply be inaccessible. And health services, health systems, there can also be challenges, things that make it difficult. At this level too, there can be a lack of accessible information or invitations to screen and reminders to screen, and we're wanting to change that, of course, and costs to see the doctor. Families and support workers can also, they obviously you in the audience play a very important role in supporting participation in cervical screening. But we do know sometimes that families and support workers can sometimes be a bit overprotective, always with the best interests of the person at heart, but feeling, oh, look, that person with disability doesn't need screening or wouldn't be able to tolerate it. But in fact, of course, we need to actually be talking to the person with disability themselves for them to make that decision. And there, again, can be misassumptions about sexual activity. And in fact, sometimes family members and support workers may not be quite so up to date and may not know that there's a new way of doing cervical screening with a self-swab, for instance. So that's why it's important that we're putting on these webinars and training as well for this important group of supporters. So what can make cervical screening easier for people with disability? Well, at the clinic, it's important to let the clinic know about any additional needs and supports that the person with disability might have. That could be you getting in touch with the clinic or support person, but important for the doctors and nurses to know in advance. And of course, you can always ask for longer or multiple appointments. very important. You don't necessarily need to have cervical screening today. It can be deferred, it can be put off. And it's important to know whether there's height adjustable tables and equipment and hoists. We want to raise awareness amongst all practices that, of course, we want people with disabilities to be able to access the services like anyone else. And it's all about supporting choice. We need to ensure that the person with disability is supported to speak up for themselves and supported to speak for themselves and not have people speaking for them. It's important to hand out accessible information. We've got some excellent information now, as you'll see in Easy Read, for instance, and to understand that it's okay to delay the cervical screening test. People can take the time to decide about the test if they don't feel comfortable, or that they want a little bit more time to think about it. People can choose how the test is done by the doctor or nurse or a self-collection or self-swab. And of course, we all need to help people with disability understand their rights as well. So let's now move to the National Cancer Screening Register. It's an important component of the National Cervical Screening Programme. So the National Cancer Screening Register, it's not just for cervical screening, it actually is also for the bowel screening programme, and now we've got a new screening programme, the lung screening programme. And what is it? Well, it's a database. For you, it contains your personal electronic record, which is linked. If you're in the screening programme, it has the information about your cervical screening, for instance. It sends letters or SMS messages to screening participants. And this is around invitations to start screening at age 25. And then a reminder is sent every 5 years for cervical screening. It also serves as a little bit of a safety net as well. So if you're referred by the doctor to that specialist test that I mentioned, a colposcopy, then the register, if it sees that you haven't been to that specialist appointment within a certain period of time, it will follow up with your doctor to start with, but sometimes it will follow up with you as well. It provides a safety net. And the register is really important in being able to monitor the programme, see how it's going, how are we going in reaching people who are under-screened, for instance. So it plays a very important role. Now we're going to meet Margot. So here's Margot, and some of you may recognise her because she's the marvellous actor with Down syndrome who was in the Screen Me campaign. So Margot is a woman with lived experience of disability. She's going to turn 25 in 3 months, and she gets a letter about her first cervical screening test in the post. She finds it a bit difficult to understand, and she talks to her sister, Augie, and Augie comes to the clinic with her. So Margot shows the letter to the doctor, and she says she's asking for some extra help with cervical screening. She wants to get some support about taking part in the screening programme. The doctor is able to check the register, and she finds actually that this is obviously Margot's first screening test, but she finds that her phone number is out of date. The address is fine. So the doctor asks Margot if she can update her phone number, and Margot's very happy for that to happen. So that's an important role of the register. The doctor lets Margot also know that she could choose someone to help her take part in the National Cervical Screening Programme. This person is called a personal representative, and we'll find out a bit more about it. This is a person that can help with the administration of helping someone to participate in the screening programme. So Margot wants her sister to support her, and she chooses Augie to be her personal representative. Augie is kind and listens to Margot. She understands what Margot wants. Margot says that she feels nervous about the cervical screening test. She's very glad that Augie will support her. The doctor gives Margot easy read information to take home, and she comes back with Augie 1 week later. And she takes her very own first self-sample, self-collected test with the self-swab. The doctor asks her to come back for another appointment so she can explain the results. So Augie comes back in another 2 weeks with Margot, and the doctor tells Margot that her test shows there is no HPV detected. I have to say Margot is very delighted, very happy, because this means that she doesn't need to have another screening test. She can come back in another 5 years' time. Now, 5 years sounds quite a long way away to Margot, so she's very happy to hear that the register will send her a letter to remind her about future cervical screening tests, but she's very glad that Augie, as her personal representative, will also get these letters too. That gives her confidence to know that she'll know when the time is right that she needs another screening test. So I mentioned about the doctor giving Margot some helpful information. So we'll share all these resources and links to the resources with you afterwards. But on the National Cervical Screening Programme website now, that's the web link, there's a link to a suite of accessible, easy read resources. They've been co-designed, co-created through the Screen Equal research project, which I've had the privilege to lead with people with intellectual disability. And we've got 3 resources and an overall one as well before my cervical screening test, during my cervical screening test, and after my cervical screening test. Really useful to read. And this is Sarah Simmons, who lives in the Hunter, and she's the star of all of these. Well, there's also videos as well as these information resources. So let's now come to talk about what you need to know about the National Cancer Screening Register participant portal. Well, what does that mean? So this is for people who are taking part in the program, having cervical screening tests. And this allows that person, people in the program, to look up some information and to actually change some information about their circumstances. I'll go through it all, just to make sure that the register is up to date. You access the participant portal through MyGov, and you may all be familiar with MyGov. It's used to link lots of different personal information, like your Medicare records, for instance. Then you can link it to your cervical screening records and link it to the tax office even. And there is an app to be able to do that. So what does the participant portal allow you to do? So it allows you to update your personal details. So the doctor did that for Margot, but you can do that through the app as well. So your address, for instance. You can update communication preferences. So maybe you've been getting letters, but you've heard you can now get an SMS reminder. And so you can let the register know that. You can also see previous correspondence from the register. And this is important because it allows you to know, when your last cervical screening test was, and importantly, when you're due for the next test. People get a little bit, sometimes they worry about privacy and the participant portal. It's really important to know that this doesn't contain your personal health records. This doesn't contain the results of your tests. It's just the correspondence. The results of your tests are kept securely. And if you want to access your results, that's through your doctor or nurse. So that's important to be aware of. Now let's have a look at the personal representative function of the National Cancer Screening Register. So as I mentioned before, the personal representative, it's an administrative function for someone to make requests to the register on someone else's behalf. So Margot has obviously chosen Augie to have that role. Now, this is not, no one has to have a personal representative. It's just if you feel that it's going to be helpful for you. It's not just for people with disability either, of course. It may be for someone who's come from another country and doesn't speak English as their first language. They can choose a personal representative to help read the letters, for instance, that come from the register. So a personal representative plays an administrative role in supporting screening participation, and it's a trusted person. Cervical screening tests are 5 years apart, so it's someone who's going to be a bit of a constant in your life. It could be a legal guardian if you have one, but it can also be a family member or a good friend. It's generally not a paid support person who tend not to be, that tend to change more. And if you want to nominate someone to be a personal representative, then you can do this by calling the register. You can go online, or you can get someone to help you, like your doctor or nurse, for instance. So it's important to be aware of this. Many people don't need it. Most people don't need it, but people are happy to know that it's there and that it can be used if someone really wants it, like Margot. And supporters, of course, play such an important role in helping people with disability to get cervical screening. Always, of course, helping people make their own choices, to respect the rights of people with disability, to be in control of their own lives. And I just wanted to remind everyone as well about the CHAP. This is the Comprehensive Health Assessment Programme. And this is an evidence-based tool for conducting the annual health assessments for people with intellectual disability. And it includes information about cervical screening and other screening programs too. So just an important one. So I think I've talked enough for now, and it's definitely time for a 5-minute break now. We might come back in 4 minutes, perhaps. We'll come back in 4 minutes from now, and then we're going to hear from the screening advocate. So do take a break. We'll switch off our noise now, and we'll see you back again in 4 or 5 minutes. So thank you all. Welcome back, everyone. Hope you had a nice few-minute break. I'm delighted now to actually hand the stage to two of our fantastic cervical screening advocates with lived experience. Tammy and Sue, actually, we met them briefly before. They're going to actually do a role play for us. And just to say they're part of a nationwide pilot program for cervical screening advocates from all around the country who've come together to share their experience of cervical screening. Most people, and you'll see from Tammy and Sue, are actually fantastic advocates, but also just to learn a bit more about cervical screening. And we've been doing some filming as well for some future training for support people. So without further ado, I'm going to hand to Tammy and Sue and take it away with your role play.
Thanks, Deborah. Hi, Tammy. How are you today?
Yeah, I'm really good, Sue. How are you?
Oh, I've got something to tell you. You're not going to believe this.
What have you got to tell me?
I was at the docks the other day, and you know they have the leaflets there, and it said that you could do your cervical screening by yourself.
What?
So yeah, I know. You know, years we've been doing these speculums, and well, if we ever went. Anyway, I went into the docks and I said, "What's this?" And she said, "Oh, well, you are actually due for one." She gave me a kit, and it was like, you know, the things that you use when you had COVID.
Yeah.
Yeah, and you put it, and it's the same sort of thing as that. At this one, you put it up your vagina. You know, if you had you use a tampon, put it up, swish it around, take it out, put it back in the tube, give it to the doc. The doc lets you know the results.
Like it's not as big as a tampon, is it?
No, it's like a very thin with a little soft tip on the end which collects the stills. Yeah.
Good. Oh, that sounds really good. Like so much easier than the old way where you had to like have that metal thing and it was horrible.
Well, I mean that's still used, but I mean for the vast majority of women, you know, we're on the well, I'm on the end of that list of women, but you know, if I years of doing it the other way, and the last one I had was fantastic. You know, I could do it myself, independently managed my medical treatment there, which was very rewarding. And
so better.
Yeah, because I know you've had some difficulties with some of yours in the past, you know.
Yeah, this will make it so much easier.
Yeah.
Just not having to climb on that bed, and even if I do need to climb on the bed, I know that I don't have to be subjected to the speculum. I can just have the whiz round in the vagina, and that's it.
You can have your little stick. It's very empowering for a woman to be able to do that themselves. You know, it's a game changer, really, and you know, I'm just so glad. So I've just spread the word to my mates, and they couldn't believe it when I told them that this is what you could do.
I'll have to try and tell my people too, and the next time I go in, I'll actually ask for it.
Good idea, Tam. Yeah. Well, I'll see you next week at the meeting next week. Okay.
Okay.
Have a good day.
Okay.
Bye.
Thank you. Bye.
That was fantastic. They're just stories from the heart, I have to say.
Yeah.
And so I thought what we'd just do now is I'll just ask you both, and maybe I'll start with you, Sue, why you wanted to become a screening advocate, because you both, you know, I know you do a lot of advocacy in all different ways, but just if you just let us know that.
I think essentially anything that improves the life for a woman is good. And if I, in my position, can you know, put the word out there, which I'm quite a loud person, really. So it's good to be able to do it. And my groups I've actually said, so the reason I've done it is because I can. And it's something I can do as a disabled person living with a disability. And it's and I can talk and I can, you know, and the fact that I was selected to do it was so much boost to my confidence that I really felt that it was a must. Thank you, Deb. That's how I feel about it.
No, thank you for sharing that. And what about you,
Yeah.
Tammy?
I was also very proud to be selected to be involved in this program. So, as I said before, I hadn't had a screening test for 13 years because of the trauma of, having it before. And so when I actually went to family planning here in Tasmania and I was offered that test, it was like so much better. It was actually a relief. And I guess I wanted to spread the word to other women in my situation that were, suffering greatly at the having to physically, manipulate themselves onto tables, and this has made it so much better for my community, women with physical disabilities. So anything I can do to help the community overall of women with disabilities, I'm really proud to be involved.
Oh, well, you're fantastic advocates, and it's good to remember. Yes, you're in Tasmania, and Sue, you're in Adelaide or Adelaide Hills. Is that right?
It heals. Yeah.
Yes, no, it's fantastic. So I see that we've got a question also in the Q&A, and do, as Marianne says, just keep those questions coming. I was going to just raise that there is a project going on at the moment. It came up in one of the other webinars to co-design a new self-swab that can work for people with disability, because some people with disability find the current swab, even though it's pretty simple, just difficult to use. So that will be interesting to see. That's the swab, if you remember rightly. So that's a good thing. Sue, I'm going to come back to you just for a minute, because I know we've talked about, being a menopausal woman and what that's like in terms of cervical screening, because it can sometimes mean that it's a little bit more painful to have a cervical screening test, can't it? So I don't want to put you on the spot, but if you're happy to share anything.
Yeah. Mm-hmm. Yeah. Oh, well, to tell you the honest truth, I avoided it. Like Tammy says, and so I was probably, putting myself at risk in a sense by not having the test, because you have to go somewhere and have it done. The question, can I refer to the question that's been asked about whether you can do it? Well, when I went to the doctors to have mine done, I went to their bathroom, and my surgery has a bathroom, did it myself, took it back there, but I believe you can take it home and do it yourself in private, and then take it back to the doctors. You don't have to do it in this, in view of anybody. It's a private thing you do yourself. So
no, absolutely,
and often women of an age say, "Oh, I don't need to do that anymore," and you actually do. I think Deb, did they increase the age?
Yes, it used to be 69, Sue, and now it's gone up to 74. So, and that's good. And I know what we do sometimes for women who've been through menopause is to give a little bit of hormone. So so cream or little tablets to put into the vagina, and it can make taking the test much more comfortable. Because it can sometimes be uncomfortable. Self-collection, though, a self-swab shouldn't be uncomfortable, but you can always talk to your doctor and nurse about it. And just to answer that question a bit more, so thank you, Laura, just in terms of how do you get an at-home swab kit, the key thing is to talk to your doctor's surgery or the nurse, and whether they've got a system where they are doing telehealth, for instance, and then they send the kit to your home, or you pop into the clinic and pick it up yourself. You can do the self-test in the clinic, but as Sue says, you can also do it at home. And what we're doing now is looking at flexible, just really starting to look at how we can make sure that we bring people who are not being screened into the program. And we know that we need to look at new flexible ways of doing the screening test and do it in ways that people want. And we know for people with disability that in New South Wales, for instance, there are some home visits by women's health nurses. I've just been speaking to women's health nurses this morning about elimination of cervical cancer. So I think it's about having flexible approaches. and doing what's going to suit you. And I think the other thing I know from our research, just talking to someone with a disability who didn't know that they could ask, they didn't want a speculum exam, but they wanted a cervical screening test, but they couldn't do it themselves, and they didn't know that they could ask the doctor or nurse to do it. So they said, oh, that's like a third method of screening. So it's interesting. It's interesting. Tammy, is there anything else you'd like to add? And then we'll open up the floor for Q&A.
Well, I guess that before starting this project, I did ask 10 of my friends with physical disabilities how they went about getting the cervical screening test, and the results from that sort of questionnaire was really quite damning, that, you know, the word wasn't quite out there yet. So that's why this program is really important, so we can spread the word that, you know, self-collection and assisted collection by a health professional is so much easier than the old speculum test. So thank you.
No, that's fantastic. And we do thank the government actually for really putting a spotlight on people with disability, including we haven't had data, good national data to show us, you know, whether people are being screened or not with disability, but that will change soon, which is great. So what I might do then is just go to the last few slides and then we'll open up the Q&A. So we just want to share some further information, but get your questions ready. Thank you. Fantastic. I just need to go to the next slide. There we go. So we did just want to share the information about the Screen Me campaign. So this was a co-designed campaign that ran, it was a social media campaign that ran for 3 months at the end of last year. It was aligned with the Own It campaign, which you might have seen. And it featured centrally this fantastic short film, a 4-minute short film created and made by Bus Stop Films. And they are a fantastic inclusive film company. And you can see here there's the actors playing Margot and Augie. And I'd urge you all to go to the website. So the Department of Health, they actually have a whole microsite devoted to Screen Me. So it's got really useful accompanying resources on it as well. So please do look those up. So just the take-home messages before we come to the questions. So Australia does want to stop cervical cancer and wants to make sure that no one is left behind. So thank you for joining this webinar. Self-collection with a self-swab can be a useful choice for people with disability. It's about knowing your choices, and support people have an important role in helping people with disability to have a cervical screening test. People with disability may need additional support for follow-up after their test if they need to go to the specialist, for instance, and that's important to recognise. And the personal representative function of the National Cancer Screening Register can be a useful tool for some people with disability. And do check out all the accessible resources. So we'd just like some acknowledgements for, again, the National Cervical Screening Programme. Thank you for the support you've given for these webinars. We've got other partners, Deaf Connect, and of course, the screening advocates themselves. So you'll be meeting 2 wonderful advocates today, but we've also got other advocates out there. There's Emily, there's Carleen, there's Polly, and who have I missed? Lani, of course. Lani, yes, Lani. So, and, you know, it's from all around the country. So we're delighted that we're going to be able to continue this program next year. So that's fantastic. So I'm going to stop sharing my screen now. And I'm going to hand to Marianne just to moderate the questions. And please do keep them flowing.
Thanks, Deb, Sue, and Tammy. That was wonderful presentation and a great sharing and Q&A. We have a question that's come into the chat, and it's about co-design. So I might ask Emily to join this conversation as well, because Emily was really a core part of bringing the group together. But maybe we'll start with Tammy and Sue. Maybe you can talk about why co-design in this space is important, and what you think it adds in terms of information and education. And then Emily, the question from Chelsea is, can anyone be part of the co-design group? And you might want to talk about the process you went through for that. So I'll hand to Tammy and Sue first.
After you, Tam.
Thanks, Sue. So why co-design is really important. It it puts the authentic voices of people with disability in the process. It's like things aren't done for us, they are done with us. And so we can use language and be involved in developing the program so that we can understand it, and then hopefully our cohort can understand it as well. It's not, we don't want it to be too academic. We want it to be more user-friendly, disabled-friendly. Yeah.
Wonderful. Thanks, Tammy.
Yeah, I support anything that Tammy says there. That's great. I think because the group that we're involved in at the moment are all varied. The disabilities are varied, so it's great to talk to people who have a different disability perspective, because we're not all lumped as one group. There's a huge range of disabilities, and Lani, who is vision impaired, is one of the advocates. She's working with Monash, I think, in Melbourne on this. As Deb referred to, the swab will have some sort of mechanism that assists in using it for people who are vision impaired. Now, I never even thought about that before I talked to her about it. So I'm learning all the time from this process, and passing it on through working with Emily and Lauren and all the wonderful people organising this. And we've had some very interesting Zoom webinars, Zoom meetings on this subject, and it's quite. You have to really think about what every aspect of the disability as much as you can, you know. So I found that really useful and interesting and educational. Yeah.
Fantastic. And Emily, in terms of you're obviously been driving the co-design part, and we obviously have some people online who are interested in it. How did it come together? And I suppose that to answer it, can anyone be part of the co-design?
Yeah, it's a great question and a really important one that actually really reflects what co-design means. So not everyone can be, because it has to be responsive to the community that will use it. So we were looking for women and people with a cervix with lived experience of disability, because we really want to improve how the services work for them. So it has to be a very specific group. And I think having people who have a passion and a desire to share really helps with the co-design process, because co-design, when it works really well, needs to be a sharing process, a process where people are able to see things from their own perspective, but other people's perspectives, to build something together. And that's what we've been doing, as Sue and Tammy have described. Yeah.
Yeah, wonderful. It was a great process. And I think the richness of those discussions and the sharing comes through in the information that you've shared with us today. Deb, as somebody who's so knowledgeable and such vast experience in cervical screening, what did the co-design process bring to your education of cervical screening and perhaps the challenges that exist for people with disabilities?
Oh, it's a really good question. I think it's certainly, well, ever since I've started work really with people with disability, it's really just opened my eyes. And I've been providing cervical screening for over 25 years to people, including for people with disability. But I'd never, you know, you're so busy that you don't stop to think about what are those real barriers, and take us, you know. So it's allowed me to be able to take a step back and really think back, reflect on all my experiences, but also I'm involved. I do a lot of training for GPs and nurses, and so to be able to share that through the co-design process is actually fantastic. But I've just learned things that I could never have just seen myself. So it's just absolutely invaluable. And the true co-design, as you all say, it has to be that it is driven by, in this case, people, you with disability, that you're absolutely front and center. And what's that saying? Nothing without us. There's a saying, isn't there?
Nothing about us without us. Yeah.
Yeah. And I think it extends. We heard the very tangible example of the swab being designed, which is fantastic. But then there's also, of course, around use of data and systems and policies that have to be led by the community if it's about the community. So I think I've just learned a lot. So thank you.
Wonderful. As have I. Every time I join a webinar, I learn something new. So I'm very grateful for that opportunity. I'm conscious that we've come to nearly the end of time. I want to make sure that you have a chance to maybe leave us. What is the message you want people to leave with today? They're going to go on and maybe talk to colleagues, talk to family members. What would you like that message to be? And I'll start with Sue, and then if you want to pass it on to Tammy, Emily, and Deb. Thanks.
Thanks, Marianne. I think the message is go to the doc, ask. I mean, it's a tricky one about how you sort of get that message out there, because it needs to be out there. I believe that over time it's going to get there. It's going to get there, like you would with the way the breast cancer and the bowel screening projects. I think there'll be time when it is more visible, and there's work to do to get it there.
Yeah, great. Thanks. I think that, and the advocates will be a central part to that work.
Yeah. Well, we just love talking about it. Well, advocates for anything. I mean, it's ridiculous. I don't know if you had and you can see on the faces of friends and people, they don't know about it. And so if we can promote it as much as possible talking to anybody.
Amazing. Thanks, Sue. Tammy, what would your takeaway be for people?
My takeaway would be ask questions, ring your clinic, let them know what your needs are, and that you have heard about cervical screening with the self-collection, and that's what you want to do. And also spread the message to all of the community so that, we can all be protected. This program can save lives. I just briefly want to say that I was at an agricultural show and actually had a conversation with two women that I didn't even know about cervical screening. So it must be at the front of my mind, because we talk about it everywhere now.
It's true, isn't it? Yeah. And I was at a meeting yesterday, one of my advocacy groups for disability, particularly focused on access, a local one, and there were more gentlemen there than ladies, but I told them all about it, and I thought, I'm not embarrassed to tell you about this. You might know, you might mention it to your wife or your partner or your friend. So I saw this woman talking about this cervical screening, but that's how the message gets out, the grapevine, that sort of it sort of spreads. So that's what we do, and we do it for all sorts of things, don't we, Tam?
And I love that you mentioned, not being embarrassed, because I think for too long, women in particular have been embarrassed about their bodies. There's shame. There's, not talking about things that are really important, which then put our lives at risk. So I think that's a really important point to have raised. And Tammy, talking about it at the agricultural fair sounds perfectly fine to me.
Yes.
Emily, do you have a takeaway for the audience here today?
Yeah, I think I just want to highlight the power of co-design just as a fantastic process to be a part of. And there was a comment in the Q&A, and I'd just say to look out for opportunities to co-design, because it can be a way to meet with other people that you wouldn't have met before and hear their stories and develop that richness. So that's
Wonderful.
cool.
Thanks, thanks for your leading that co-design so well and so collaboratively. So, Deb, I was going to give you that question as well, but one has popped into the chat, so I'm going to give you the one that's in the chat if that's all right.
No, that's all
Um,
right. I'm just looking at it now. So
yeah, so I'll read it
we
out
know,
for anyone who hasn't
yeah,
seen it because it just came into the hosts and panelists. So Lauren asks, do you happen to know if there are any initiatives in New South Wales to encourage widespread trauma-informed care for women, people with disabilities? I think a lot of people completely miss this type of healthcare due to mistreatments, past traumas, lack of care from healthcare providers.
no, it's a really important question. And in fact, through this program last year, we did actually have some webinars for GPs and nurses, and that included trauma informed care. And you can access, there's a webinar that you can access still on the National Cervical Screening Program website, and we'll send those links. I would suggest, family planning clinics, they do fantastic training. I'm not aware of training courses that are on right here, right now, but we certainly should advocate for them. Through the Screen Equal project, if you're a doctor or a nurse, and you can actually join and undertake some trauma-informed training, and you'll get real, some points and CPD points for that. So again, if you go to just Google Screen Equal, and we can send that around as well. So I think that the world is waking up to the fact that it's really, really important that we provide trauma-informed care. So I think it's an important thing to end on, and to know that there's positive things happening as well.
That's wonderful. I'm just trying to put that in the chat actually for people how they have that website because, like you said, there's lots of great resources there. So we've just gone over time, and I know this is probably people's lunch break as well. So you probably need to get back to whatever your day has ahead of you. Thank you so much, Deborah, Tammy, Sue, Emily, and everyone behind the scenes, and to our wonderful interpreters as well, Beck and Priscilla. Really appreciate you being here and supporting and making this an inclusive webinar. Resources will be shared, and yeah, look out for more from our screening advocates.
And thank you, Marianne.
My
Fantastic
pleasure.
moderating. Thank you all.